The 4th of February is World Cancer Day, with the theme of closing the care gap. At West Yorkshire and Harrogate Cancer Alliance, we passionately believe everyone deserves the same access to high-quality cancer care. Our Healthy Communities programme aims to increase the uptake of bowel, breast and cervical cancer screening as well as prevention of cancer by promoting initiatives such as encouraging stopping smoking. We recognise the power of working together. Each team has a vital part to play in helping to create a cancer-free world.
More people than ever are surviving cancer, with more than half of those who receive a cancer diagnosis living 10 years or more. We need to make sure that we don't just help people to live longer, but to live well. Our Living With and Beyond Cancer team helps to ensure that care and support is tailored to each person's specific needs and those of their loved ones.
Our innovation team works with the innovators and clinicians to make the very best use of new technology as it becomes available, and new ways of working which help to support the transformation and delivery of cancer services. This includes an annual competition which funds these types of projects to improve early diagnosis and patient experience, in line with the NHS long-term plan.
The Targeted Lung Health Check programme invites those most at risk of lung cancer to come forward for a check, and we work with partners in areas with some of the highest lung cancer mortality to support earlier diagnosis of lung cancer, with the aim to diagnose at an earlier stage, with stages 1 or 2 when it is much more treatable. The programme now aims to offer a targeted lung health check to all eligible patients across West Yorkshire and Harrogate by 2028.
As analysts, we examine a broad range of cancer data across the patient journey, from access to diagnosis through to those patients living with and beyond cancer. To do this, we build a range of business intelligence products which support the Cancer Alliance in delivering our strategic objectives, with a specific focus on improving patient experience whilst addressing inequalities and variation in outcomes.
Focusing on 10 of the most common tumour sites, our optimal pathway groups aim to ensure that clinical services for cancer patients are of consistently high quality and coordinated from prevention to diagnosis and treatment to living with and beyond cancer. Outcomes and experience should be the same for every patient, irrespective of where they live and wherever their care and treatment is provided.
In Workforce, we support our partners to make the very best use of their number one asset, the people who work for them, addressing barriers to the delivery of cancer services. This includes an ambitious project with Macmillan to increase the number of cancer nurse specialists.
Diagnostic tests such as X-rays, blood tests, CT scans and breast screening play an integral role in the detection, treatment and monitoring of cancer. We work closely with providers of diagnostic tests and scans within our region to understand waiting times, capacity and new approaches to testing which may affect diagnosis.
It's important that we address inequality in access, care and outcomes. This ultimately impacts on how people experience their cancer journey. World Cancer Day provides us with an opportunity to highlight the work we do every day to reduce inequality and close the care gap.